This Knights of Columbus social meeting features Dr. Wesley Cotton. He's talking about Beyond the Spine, unlocking the full potential of chiropractic care.
Unlocking the health benefits of chiropractic care. And with that said, please join me in welcoming our guest speaker this evening, Dr. Wesley Cotton.
Hello, thank you guys for having me here tonight. It's really an honor to be able to come and speak with you guys. Becky first came to me and to ask, would I be interested in just kind of having a small talk with some of her friends in her walking group, and it kind of evolved into coming here and putting on a little something for you guys, because you guys have all probably heard of chiropractors and you're familiar with what they do, the popping and the cracking. But there's a lot of stuff that's kind of going on in the back that you don't really see, or you may not even necessarily feel. So that's kind of what I want to focus on tonight. Just a little background about me. I like long walks on the beach. No, I'm just kidding. So I am a Ballston Spa native, though. I graduated from Ballston Spa High School back in 2012. I went through and I did my undergraduates in SUNY Oswego up on Lake Ontario, and then I finished my doctorates in chiropractic at the end of 2021. From there, I kind of took an associateship, time to kind of learn about the business side of things, and then just a little over a year ago, I had the pleasure of being able to open up my own office just across the way here on the opposite side of 146, and I've been just kind of growing my own practice from there. So to kind of just get into things, what I want to start off with here is kind of painting a big picture of what chiropractic can do, and then kind of break down into the finer things from there. So to start, I'm probably going to bore you for a brief moment. I'm going to spit some numbers out at you, and then we're going to get into what I really want to talk about, which is more focusing on the nervous system. A 2007 study showed that those who had a chiropractor as their primary physician had 60% less hospital admissions, 59% fewer days spent in a hospital, 62% fewer outpatient surgeries and procedures, and 85% less pharmaceutical costs. I know at least one of you are sitting here thinking, Doc, it's from 2007. That's a little dated, don't we think? Like 2007, we all want it to be like yesterday, but we're coming up on 20 years ago. I thought of that. I have a second one. If we can get the next slide. Ka-chow! 2024 review of 44 studies. So this was a kind of like a literature review that looked at 26 cohort studies, 7 studies, and 1 randomized control trial. Without getting into all of the word vomit that is on the screen there, I'll tell you what, it says more or less the exact same thing that we saw on the previous slide. Less hospitalizations, less surgeries, less opioid prescriptions, fewer injections. The general consensus that we can get here is that chiropractors are fairly decent pain management providers. I don't think anyone's going to argue that. But what about things that aren't pain related? Because again, we all think about neck and back pain with a chiropractor, but what about things that just don't involve pain? So when I first graduated, I had the pleasure of shadowing another chiropractor. I wasn't hands-on at this point, but I got to experience and I witnessed something that was really cool. So this doc kind of built a reputation in his community as being someone who you went and saw when you just weren't getting answers. Didn't work out there. It wasn't intended to be work out that way. It's just kind of how it happened. So I met a woman who came to him. Her primary complaint was infertility. She couldn't get pregnant. She had been to other docs. She had tried IVF. Nothing was working. She went to this guy as like a Hail Mary last resort. Within 3 months, she was pregnant. What the heck happened there? Because I don't know anyone that goes to a chiropractor to get pregnant. That's just something that we witnessed. Now, I got to slap a big fat asterisk on this because that's anecdotal. That's something that I got to witness and I got to experience. That's not something that in science that we can easily reproduce. A chiropractor can't just get a woman pregnant. So in terms of science, it's hard to reproduce. It's hard to get it consistently. So just throw an asterisk next to that. But I want you to keep that story in the back of your head because we're going to come back to that to talk about how exactly, how could that have been possible? Because that's kind of cool. Next slide, please. So, in order to talk about what I really want to get into, which is the nervous system, we're going to do a quick breakdown of what we're talking about when we refer to the nervous system. These are things that you probably already know most of. We have the central nervous system, we have the brain, and then we have this long guy going down the center here. That's just the spinal cord, right? Those little wiry offshoots that come off of it, those are your peripheral nerves. The brain and the spinal cord make up our central nervous system. Those little offshoots make up the peripheral. You can think periphery, the outside. You see the words sympathetic and parasympathetic up here. Just make note of them. We'll talk about them later. I don't want to throw too many words at you all at once. Who runs the show? What controls the body? Brain. Yeah, right. How do you think it does it? The nerves. The nerves control the body by the brain. Can we have the next slide? So, in order for the brain to make a decision, it has to have information to do so. We have our basic 5 senses: smell, taste, touch, sight, hearing. We're constantly pulling information from around us that our brain can then digest, process, and then make decisions on. It's how we interact with our environment. I can see the car that's coming down the road before I cross. I can smell the toast that I'm burning in the kitchen. But what are those ones down there? Proprioception and interoception. So if these ones up top, they help us interact with our environment, well, these ones down here, well, they help us interact with not only our environment, but with ourselves. We could have the next slide. So I want to talk about proprioception first. Proprioception is our body's ability to know where it is in space. I can turn my head, close my eyes, I can hold my finger up here, and I can still come touch the tip of my finger. I know where it is. I don't have to look at it to see it. That's proprioception. Interoception is the body's ability to sense and interpret what is happening inside of itself. So first thing in the morning, your alarm goes off, you get up, your stomach starts grumbling. That sends a signal to your brain that releases a hormone that tells you you're hungry. What do you think sends that signal from the gut to the brain? It's the nerves. They're the pathway for the gut to communicate with the brain. What do you think could happen if those nerves, these things that send the messages and receive them, are interfered with? Paralysis? It's like a severe example of that. Think of someone who can no longer move their arm. Those nerves no longer send the message from the brain to make muscle contract. That's what paralysis is. What about MS? Multiple sclerosis. That attacks, it's a disease process that attacks the insulation that lines our nervous system, and that insulation kind of helps send the signal. If that insulation gets damaged, the signal can't be sent as well. If you know anyone that has MS, you know what they go through, and it's not always the most fun. Small example of what can happen when the nerves get affected, or at least in that sense, it's a little bit more of a severe case. But what if it's not that severe? What if it's, mild? What if we go to the next slide? Thank you. So, we see on the left side here, it's a small section of lumbar spine. It's the lower back. We see these little kind of backside bony parts, these little bony tips. Those are spinous processes. Those are the bumps that you see on someone's back. That's these guys. You have the spinal cord that runs right up the center, and then we have these little offshoots, these little peripheral nerves. In order for those to send and receive signal, they got to be happy, they got to be healthy. They got to play the right tune. This is not my analogy. This analogy was given to me by one of my mentors, but I think it does a really good job of portraying how nerves function. Do we have any guitar players or, former guitar players here? No? Well, we understand the concept of music though, right? If you have a guitar, it has to be in tune to play a certain note. You pluck a string, it plays said note. But what happens if you put pressure on one of those strings that you're plucking? It could be a little bit of pressure, just gently resting your finger on it, or you can press it hard. It changes the note that the guitar is playing, right? Well, nerves are kind of similar, because what you don't see pictured here is all the muscle, all the connective tissue, the tendons, the ligaments, the fatty deposits that also kind of take up space in here. So if something kind of gets a little off and starts putting tension or pressure, pulling on one of those nerves, kind of like that game of telephone from when we were kids, you say a message to one person, it goes around 30 people, and then by the time it gets around, it changes a little bit. The message can skew. So if we go to the next slide here, we're going to talk about why that matters. If you've been to a chiropractor, you've heard the word subluxation before. You might have heard it called vertebral restriction. You might have heard it called misalignment. The general idea that they're getting across here when we use these words is that something isn't moving correctly. And when something doesn't move correctly, something else gets affected. If one of those nerves gets affected, it can no longer properly send and receive signal. Okay? So let's go, I want to go back a few slides. It should be slide 4, it's that proprioception. Yeah, this one here. So what's to say, what happens with proprioception here? This is something that I see fairly often in my office here. And again, these are non-painful examples. So individual walks into my office, and the way I practice, when someone comes into my office, they're right face down onto the table, and almost all of the visit is completed with the person face down. So they enter the office, they lay down on the table, and from the head to the waist, they're straight. But from the waist down to the feet, they're skewed 35 degrees to the left or to the right. They're not straight. And I go, what the heck? Do you feel like you're straight on the table? And they go, yep. I'm like, well, I'm looking at you. No, you're not. So I'll take their knees and I straighten them out, and now I can see they are perfectly in line, and I ask them, do you feel straight right now? Nope. Why? Their brain doesn't know where their feet are. They don't notice that when you're standing because their body has like a righting reflex. You're not going to walk around like this because your eyes are going to tell your brain that you're not level with the horizon, so we got to pick the head up. We get that forward head carriage. We start to hang off that lower part of the neck. But if we hang off the lower part of the neck, we're looking down. Our eyes can tell us that we don't want to look here. We got to bring the head up. How many people you know walk around looking like this? Their head is jutted forward, but they're looking up. So that's the body's way of correcting that kind of imbalance. You have those inner ear crystals. If you ever had one that got stuck, you kind of experienced some vertigo, that's something that kind of tells you where you are in space. Once you're face down on the table, those ear crystals are taken out, and so are your eyes. All your body has, or all your brain has, is what you're getting from your feet. And if the information isn't passing through correctly, your brain has to guess. And sometimes the brain can be kind of dumb. So that's just one example. And almost every time when I see this show up in my office, I usually find something in the pelvic area. Pelvis is misbalanced, something in like L5 area, and it's just jamming that communication. Once we clear that out, by the end of the visit, the person will feel like, oh yeah, I feel like I'm straight again on the table. I don't feel like I'm crooked anymore. As far as interoception, our body's ability to sense and interpret what's happening inside of itself. You ever wake up with like a kinked neck? And you have no idea what happened. You're just like, I can't turn my head. I just feel like I slept wrong. What the heck happened? So to talk about that a little bit further, let's kind of detour. You ever step on a Lego? It sucks, right? It's not fun. This is a reflex. When you step on something and you go, and you pick your foot up because it was like a sharp stimulus, that's actually a spinal reflex. That information never goes to your brain. That painful stimulus goes to the spinal cord, kicks it back out to the foot to pick that foot up and to put the other leg down to get off that painful stimulus. The only way you actually know about it is that the pain receptors in the foot went to the brain and you felt something painful. But the action, that never went to the brain. When you sleep, say you kind of slept in a funky position, muscle kind of gets stretched into an abnormal position, it's just not happy. What happens is that reflex can get turned on. And when the body perceives an injury, the muscle wants to lock down to prevent movement, to prevent further injury. It's a broken feedback loop. So now when you wake up, the body can't sense or interpret what's happening inside of itself. All you got is this really tight muscle over here because you just slept weird for some reason. So we got to kind of break that feedback loop, break up the tissue, and remind the brain that, hey, this muscle isn't supposed to be locked up and contracted like this. We got to let it go. So that's just kind of 2 examples of things that can happen when the body isn't able to kind of get feedback properly. So let's go forward a few slides here. So that kind of brings us to the next point. Does anyone here regularly see a chiropractor? Do they ever talk about like the immune connection and how it getting adjusted can keep you from getting sick? They ever talk about how or why that is? Yeah. So we're going to talk a little bit about that because it does, and it is pretty true. But why is that? Viral load. If I get gross and I just, I sneeze, I don't cover my mouth or anything like that, you guys get infected, that virus immediately starts to replicate in your body. The amount of virus that you have in a sample, that's your viral load. The more or the higher the load, you can typically assume the sicker the individual is. The faster the body is able to detect a pathogen or an infection, the faster it can formulate a response. 70% of our immune system lies within our gut. Now, totally different ball game here. That's why diet becomes very important, especially here in the US. We are very high on processed foods. We don't drink enough water, and I know a lot of us definitely don't drink enough or eat enough fiber. Those are all things that we need to keep our gut healthy, but I digress. I'm not talking about our gut here and what keeps our gut happy. I'm talking about the nerves. 70% of our immune system lies in our gut. How does the gut talk to the brain? The nerves. So if the nerves to your gut aren't happy, it's going to have a hard time sending that signal out to the brain to start the inflammatory response or the immune response. Brings us to vagus nerve. Vagus nerve is like every chiropractor's favorite nerve. It is the primary parasympathetic, there's that word again, nerve in the body. You can go right down to the next slide there. This nerve controls digestion, it controls heart rate, it controls the immune system. It's largely tied to the immune system because of the inflammation process. Scary word, inflammation. Inflammation is a good thing. Chronic inflammation is a bad thing. When inflammation doesn't get turned off, that can lead down to all sorts of different problems. But in short term, we need inflammation because that's what helps heal. So vagus nerve primarily controls that. If vagus nerve isn't being activated because most of the immune system lives in the gut, can't communicate with the brain, nothing goes down vagus, you can't formulate a proper immune response. So you build more of a viral load before your body's able to detect it. The higher the load, the sicker you get. You want fast detection. So you want a happy gut, you want a happy nervous system. Primary parasympathetic nerves. Pumps the brakes. So the other word here was sympathetic. If we go back to that slide, it was sympathetic and parasympathetics. Your sympathetic, that's your fight and your fight and flight. Like you see a lion, right? Your heart rate goes up, your blood pressure kind of goes up, and you kind of get a little anxious, you're nervous. That's sympathetic. Your parasympathetic is your rest and digest. That's what kind of allows us to fall asleep at night, what lets us relax. Your sympathetics are on all the time. The only thing that pauses them or pumps the brakes is the parasympathetic. You ever get really mad and you just like want to scream, so you do. You like shove your face in a pillow and you just like let it go. Then you get up and you're like, wow, I feel better. What's that about? Well, vagus nerve passes very closely to C1 and C2. That's right up here in the upper neck. What else is there? Our vocal cords. When we start shouting, that vibration stimulates the nerve, puts us into more of a rested and relaxed state. We as chiropractors can also stimulate that when we adjust you. You have parasympathetic cell bodies that lie in the upper neck and down here in the lower back. This is something that can be measured, and when we adjust that part of the spine, we activate that part of the nervous system. So if you go to the next slide there. Oh, forgot about that one. One more. There it is. So I have my friend here. This is a video I shot. Honestly, I couldn't tell you when I did it. Probably about a year ago. This is one of my friends here. I had him come in for this demonstration of exactly this. So you can see I'm picking up his leg off the table here. This angle is 6 degrees. All I was doing was getting a foundation or a baseline to see where the tension was in his hamstrings. We're not doing any kind of stretch here. All he did, or all I did, was lay him down. I picked his leg up until it just felt like it wasn't going to go any way higher, and then I brought it down. I didn't hold it. There was no stretching done. Just a pick up, put it down. I went over to his neck. He had a restriction. If I remember correctly, it was right about midway, about C3, C4, mid-neck. I adjusted his neck. I came back down. And if we could actually just flick between this slide and the next one, let's just bounce back and forth a couple times. See that change? So the first one here, that's 60 degrees, and then the second one, you can leave it right on there, thank you. That's 68 degrees. It's nothing dramatic. This is just purely for demonstration purpose. But by doing nothing more than adjusting his neck, I was able to get an extra 8 degrees of flexion out of his hip. Or I guess 8 more degrees of relaxation of his hamstring here. Lines are the same. The only thing that's different was I adjusted his neck. Why? I adjusted his neck, parasympathetics got activated, his body fell further into the rest and digest, which relaxes the muscle. I was able to pick his foot up just a little bit further. So, you can go to the next slide there. That is what I have for you guys tonight. I thank you guys so much for listening. I feel like there is something else I wanted to come back to. If I think of it, I will add it in. But if for now, do you guys have any questions or comments for me?
Yeah.
Yes, sir.
Do you work with foot neuropathy?
In what regard?
Pain relief or treating numbness?
I do. It kind of depends case per case, though. So we would have to kind of talk a little bit more as to what might be going on there, because off the top of my head, there's a few things that could be happening. It could be tied to the spine, it could be tied to your feet. We would have to rule that down a little bit. And depending on what the cause or what I believe the cause to be, the answer would be yes or no.
Diabetic neuropathy.
That would be something that would not necessarily be, I'm not curing anything with that. I would be able to assist with that, because again, it all ties back to the nervous system, and the happier your nervous system is, the better those nerves can communicate, the better. The one thing with diabetic neuropathy is those nerves are being damaged. So I can't, do you see what I'm saying here?
I do.
So
yeah.
there's limited ability or limited options in what I could do for that.
And if I may, if there's not a second question waiting, I also experienced nerve damage down by my ankle when I had a vein harvested for a bypass surgery. Mm-hmm. And it left me with what seems to be permanent nerve damage right around my ankle, which is quite painful.
Yeah.
Is there anything you can do with something like that?
I'd have, for a quick response, I'd have to say possibly. Talk to me more after the fact, and we can dive more into that.
Okay.
Any other questions?
Do you also do extremities adjustments?
When it fits, when it's necessary. I don't do a ton of it. Sometimes it's necessary, though. I tend to find that a lot of the times extremities are more likely due to a muscle imbalance and not so much a joint problem. You can imagine muscles, they have 2 attachment sites. So if one muscle is tight and it's pulling on a joint, it can change how that joint is mechanically moving. So one thing oftentimes is a lot of people might experience elbow pain, or they get like carpal tunnel. Carpal tunnel is a big one. Oh, doc, my wrist hurts. Well, a lot of the times, like it's all bone in your wrist, but it's most of the time it's the muscles in the forearm. They get tight and they start pulling on those and it pulls everything out of whack. So I do extremity adjusting, but I usually check muscles first. Does that answer your question?
So I had my left shoulder dislocated, and my brother was now a retired chiropractor. He was snowmobiling with me because a tree got me here.
Ooh.
And within an hour, he pulled me back in place. My shoulder has never bothered me since. That was about 30 years ago.
Wow, good, nice. It's really neat what can happen when you just find the right thing.
Yeah.
You know?
Well, he was telling me that it was done early, and the ligaments and tendons didn't really have a chance to stay stretched.
Yep.
And he says the quicker you put that back, the better you'll be, and I kind of believe it.
To a certain extent, yeah, absolutely. Yeah, I would agree with that.
You focus on nerves. You mentioned that. How would things that a neurologist looks at that you might also look at or not get involved with?
That's a good question, because I'm not a neurologist. So to be completely frank with you, I'm not exactly sure how they differ. I would venture to guess that there's a lot of similarities. And then it probably comes down to holistic versus surgical, if I had to like really generalize, as most neurologists would probably be venturing to go the route of surgery versus like more of a holistic
You would
type of
consider
approach.
yourself more holistic, alternative type medicine as opposed to traditional West.
Right, yeah, like my job is to keep people from going into surgery, right? And a lot of the times it's not so much necessarily the body failing the person or the individual. It's more of like that person's body is not adapting appropriately. So I've seen individuals who come in and we get an X-ray and their spine like an absolute train wreck, but they don't have any symptoms. They're totally fine. And then I've seen people who have completely normal, healthy-looking spines, but they have every symptom under the sun. So, why is that? And I chalk it up to the body's ability to adapt. Can it adapt to the daily stresses that you're putting into it? Does that make sense?
Yeah, do you ever deal with a condition called essential tremor, which neurologists do, but it's nerve-related? So I didn't know if you ever heard of the condition.
So,
essential tremor.
Essential tremor, I've heard of the condition, and where I'm kind of going to go with this is, again, we're kind of getting into the realm of like what is actually causing this, because you have like tremors from like Parkinson's, and that's like a degradation of the portions of the brain that kind of control that.
Right.
But on the other side of things, the cerebellum here, that's like a little, it's the back part of the brain, like right back here. It's very close to the top of the part of the spine. When you initiate a motion, like if I want to reach out and grab this over here,
right,
that comes from the motor cortex up on top. But what stops it from being this kind of like rough motion, is the cerebellum right back here at the very top, or I guess base of the brain. That smooths out that transition. So to kind of answer your question, if you had something here in the very upper neck and it was jamming or kind of choking your your brain stem essentially, yeah, that could be a factor. And I have seen, so like we were talking a little bit more about proprioception, so like that kind of ties into balance and coordination. If your brain doesn't know where your feet are, you're not going to be as well balanced as someone whose brain does know where their feet are. So that is to say, if you do have something in the upper neck, it could be tied to tremors. Could.
The vagus adjustment that you described that caused the 8% gain in flexion, I'm assuming that's a temporary gain?
Yeah, naturally, yes, of
How
course.
temporary?
That, I think, depends on the individual, because people come into my office and, it depends. If we have someone who is like acute, they come in with like a real like symptomatic issue, it's very unlikely that you're going to leave the office on the first day and never have to come back, right? Usually what we tend to see is like, oh, I feel a little bit better. And then I don't see you for a few days, so you kind of regress a little bit. And then I go and see you again. Oh, I feel a little bit better. And then you regress. And then I feel a little bit better. So we kind of have this ebb and flow, but the net gain is still good over time. I'm sorry, what was the question? I kind of derailed myself.
Is the adjustment temporary in nature? The results?
The better well adapted or the better well adjusted the individual, the longer the adjustment should hold. So for someone who I see who is like symptomatic, they come in with like an actual issue, I see like a medical doctor for some kind of medication. They can change how often you take it. They can change how much you take, the dosage. When you come and see a chiropractor, the only thing I can do is change how often I see you. So if you're like acute and you're going through a symptomatic kind of flare-up of something, I want to see you more often because you're not going to hold that adjustment. So I want to see you, usually I like twice a week as a good start for my acute patients. I've never had to ask someone to come in 3 days. In a couple where I'm like, maybe I should, I haven't needed to. And then as the condition starts to improve, the adjustment will hold longer. We start to hold out care. So maybe I was seeing you twice a week for 2 or 3 weeks. Then we can dilute that down. I see you once a week for a little bit. Say we get the condition completely under control. Well, now we just want like tune-ups, right? Because you go and get the oil changed in your car. So you want to make sure your spine is okay. So that's where maybe I see you every 3 weeks or I see you once a month, that kind of thing. Just to kind of keep things happy. Because the body should be able to make those minor adjustments on its own. It just needs to have the ability to do so. The body needs to have interoception to recognize what's happening inside of itself. If it can't recognize it, it doesn't know what's happening.
In your practice, do you deal at all with sleep disorders?
I haven't seen any in my office, at least not yet anyway. I have seen, not as primary complaints, but I have seen individuals come in and note that sleep was a thing of concern. And now that ties back to that sympathetic and parasympathetic balance. If your parasympathetics, remember those are the brakes, aren't firing, they're not working, you're stuck in that sympathetic where you're all gas, you're go, go, go. You'll have, you tend to run into issues with sleep disorders. You tend to see people who suffer from depression. They're usually stuck in that sympathetic state. Their body can't relax. So yeah, you can certainly see mental health, sleep disorders with that kind of thing. Okay. Yes, sir.
So how are you going to solve the sleep disorders? The sleep problems. How are you going to correct that?
So if you come into my office, what I do doesn't change too terribly much patient to patient, unless it's like a very physical pain type of problem in which, we got to address. Now, if you come in and you tell me that your primary complaint is like a sleeping issue, you've been to all these other docs, you take melatonin, nothing helps you fall asleep kind of thing, I'm not going to tell you I'm going to cure you and I'm going to help you fall asleep better, because I don't know that. What I'm going to tell you is that there's a possibility, because it is tied to the nervous system, and I know what I do affects the nervous system. So I would tell you that let's try it. Let's give it a couple of weeks, and if you notice that you're sleeping better, we know we're onto something. If 3-4 weeks go by and you don't notice much, well, I'm not going to, beg you to keep coming in. I'm going to see what I can do to find someone to get you to who you need to see. You know what I mean? So I've seen some pretty interesting things happen. There was one individual I saw, one of her primary complaints was brain fog. She started care. She actually, and this was at the first office I worked at, and she drove an hour and a half one way to go see this doc because of the things that she had heard. And after a couple of months of care, she felt that her brain fog was clearing up. You know, that's subjective. You know, that may not fit every individual. But, and this is where you got to put that asterisk, if it's tied to the nervous system, a chiropractor can change that, possibly.
Are you a big proponent of supplements?
Oh, of course.
Okay.
Absolutely. It's, you know, that ties into just, I mentioned it when we were talking about like our immune system and, you know, how much gut health contributes to that. You know, we don't eat enough fiber most of the time. Usually most people skip the vegetables, right? So there's fiber supplements that you can take to make sure you're getting everything you need. Most people don't always eat the most balanced of diets, so maybe you're missing certain key vitamins, so taking multivitamins can kind of get those under control. So yeah, supplements, absolutely.
How would you analyze that? You do blood tests or?
Yeah, you would want to consult if you were something specific. Yeah, I would consult with your primary, and they can do the appropriate test. The test, like, you know, for deficiency and so on and so forth. Yeah. Like particularly, like if we're in the Northeast, it's wintertime. You should be getting your vitamin D levels checked, because seasonal depression is no joke, and that's tied to a vitamin D deficiency, which we get here in the Northeast in the wintertime.
Is it safe to say that everybody should go see a chiropractor? Because like you said, I feel fine, but I could be off balance of a lot of things, and you don't know. And I did go a long time ago, and she said, oh yeah, you're tilted and you're not, and this and that, but you know, and going all the time. I guess and then finally, I didn't think I needed it anymore, but I probably do.
Well, I might be biased because I'm a chiropractor, but but I get adjusted every week, and if I had the ability to get adjusted twice a week, I probably would, because it becomes at a certain point. So like when you come to my office, you're either active care or you're preventative/maintenance. If you don't have something that you're actively working through, I don't need to see you twice a week. So maybe I'll just see you once a week for a few weeks just to kind of get to know you, get to know what's going on. And then we can kind of space you out from there to where it just becomes a routine check. Like I said, I have a few individuals who I see once every other week, once every 3 weeks. And once you're under care for a while, you start to notice things about your body, and you kind of know. Like I have quite a few, several individuals who, you know, I see no active issue, but if I just don't see them for a few weeks, they call and they say, I can tell I haven't been in. And it's just weird things. It's just little things, but those things kind of add up and they compound and they kind of blow up into bigger issues. If you stay on top of them, well, they don't blow up into bigger issues. They get nipped in the bud pretty quickly. Any other questions?
Well, thank you very much, Dr. Wesley. This has really been quite informative for all of us this evening, and if we could all thank Dr. Wesley.
Thank you, guys.
Thank you very much.
Thank you.
Thank you.
And then if you guys do have any other questions, if you have things you want to discuss further, I do have some of my business cards up here if you want to take one with you. I'm happy to discuss anything you might need. I don't charge for consultations or anything like that. Cool.
All right.
Thank you, guys.
Thank you.
Thank you.